Thyroid gland diseases in dogs and cats. For an overview of the thyroid hormones, thyroid releasing hormone causes the release of thyroid stimulating hormone, causes the release of T3 and T4. They're produced in the thyroid. These hormones regulate metabolism, heart rate, temperature, digestion, and heart contraction and cell turnover. Canine hypothyroidism, the types are primary, secondary, and tertiary. Primary, which is the most common, is a thyroid gland failure due to an autoimmune destruction. Secondary is due to pituitary thyroid stimulating hormone deficiency, and tertiary is due to hypothalamic thyroid releasing hormone deficiency. Signs of canine hypothyroidism are weight gain, lethargy, and exercise intolerance. On the skin, they can get alopecia, especially rat tail, and hyperpigmentation and thick skin. Neurological problems such as ataxia and facial paralysis can also occur, and reproductive problems such as infertility and anestrus. For the diagnosis, you will see a low T4 and a high thyroid stimulating hormone, the case in primary hypothyroidism. Confirm with the thyroid stimulating hormone stimulation or a thyroid releasing hormone stimulation. For imaging, you can do a thyroid scintigraphy. For treatment, you give L-thyroxine and you monitor every 6 months. For hypothyroidism in young animals, the causes are thyroid dysgenesis and enzyme deficiencies such as perioxidase. The signs are myxedema, goiter, a large fontanelle, hypothermia, and a puffy face, and poor suckling. For feline hypothyroidism, the cause can be adenomatous hyperplasia or adenomas. Signs can be polyphagia with weight loss, and polyuria and polydipsia and restlessness. We can also hear tachycardia and arrhythmias. Other signs are vomiting, diarrhea, and an unkept coat, and goiter. Lab diagnostics, you'll expect to see a high amount of T4, ALT, and ALP. For the imaging, you can do a thyroid scintigraphy. Gold standard treatment for feline hypothyroidism is radioactive iodine therapy, iodine-131. Surgery can also be done for a thyroidectomy, and L-thyroxine is required if it's bilateral. The medication given is methimazole or carbimazole, and the diet you give low iodine, but it's less palatable. Thyroid tumors in dogs, the predisposed breeds are boxers, beagles, and retrievers. Tumors are often malignant and unilateral, and they are not hormone producing. Signs are goiter, dysphagia, and dyspnea and coughing. Often, but not always, hyperthyroidism. For the treatment, you do a thyroidectomy, radiotherapy for iodine-131 for functional tumors. In summary, dogs get hypothyroidism and cats get hyperthyroidism. Dogs can get hyperthyroidism if they have tumors.